All right. Thank you, Ashkan, for joining us. I'm Alan Butler at the Electronic Privacy Information Center, Interim Executive Director. And what is your chosen title these days? I don't even know.
Just independent researcher.
There you
What I
go.
go by.
I'm interested
Yeah.
actually to because I never have heard the full story from you before, to know kind of the quick rundown of over the last 10 or 15 years you've been working in this field, kind of how you broke in and what different interesting positions you've had over that time.
Sure. Just real quick. So my background was kind of internet startups and then internet security and architecture. Kind of going back, I've been consulting since I was a teenager. So like since I was like 16 or so. And then sometime in the 2008 or so, I went back to grad school at the UC Berkeley School of Information with like Chris Hufnagel and Deirdre Mulligan and Pam Samuelson and those guys as professors. And would take law and policy class. There's a great program there where you can do kind of a combination technology, law and policy, and business. And so I got to take classes at the Bolt Business School and the law school without having to deal with kind of law school tuition or business school tuition. And I was teaching this kind of the CS courses, so it was all free. And so I got this great exposure to kind of the law and policy intersection. And for my kind of capstone project, I looked at the state of online privacy from the perspective of both the legal analysis of what like websites would say about their collection practices and who they share data with, but also like looking under the hood to see what trackers and what third-party content there is on the web and who data flows to, et cetera. And that just happened to be kind of a lucky time to do that because generated a bunch of attention, a bunch of lawsuits. The Wall Street Journal approached me to replicate my research for them, which was kind of a cool opportunity. They're like, we'll pay you just to do the same research, which generated the What They Know series, which was the kind of the dive into privacy. And then at the same time, a bunch of the stuff I had done on cookies and responding and how companies were circumventing consumer choice piqued the interest of the FTC. And so I was hired as the first technologist of the FTC to look at these issues. So Chris and I were the first two technologists. And so that kind of kicked it off. And then from there on, I continued doing consulting for both kind of media outlets, for policymakers, went back to the FTC as the chief technologist, and then later kind of got roped into doing the California privacy law. But all of it has been the same kind of work, which is like looking at how things really work and then trying to kind of bridge that gap between law and policy and technology, basically.
Cool. And remind me, were you involved in was it your research that looked into the kind of zip code redlining online, or was that?
That was Latanya Sweeney. Yeah,
Okay.
yeah.
I
She's
remember
great.
that. It was interesting too.
Yeah.
Cool. Well, obviously, there's a lot of different stuff within, most of your work has been directly within Epic's interest over the years, many different projects. But for right now, what we're all seeing is, this dirge of new proposals, new systems, new ideas around the pandemic. And you've been very active in looking into and sort of being somewhat critical of these, including particular digital contact tracing, which I think we'll talk about first, but some others as well. So with respect to digital contact tracing, one question I had at the outset was, is there really any uniform definition of what that even is? I mean, I feel like a lot of different
Right.
things get put in that bucket.
Right. I mean, I might even step back one step back on the kind of digital efforts writ large, right? So there's essentially currently two key pieces of information that policy: who is infected, right, and two, who have. Those insights can range from traditional health surveillance mechanisms that CDC and others employ with doctors and hospitals and clinicians, capturing kind of infection rates, testing rates. There's different legal protections, as you guys probably well know, as to what those are. For example, when people get swabbed or when people get tested, whether that information can be shared. And then there's traditional contact tracing as well, which is the epidemiological kind of well-established practice, which is kind of a very I have to dig into it a little bit for doing this research, and it's pretty involved practice, pretty invasive practice around looking at someone who is then tested positive, who they've all been in contact with, and historically that's worked off interviews and off conversations with the infected person. Although there are oftentimes augmented with data that's available. There's a really good case study, 2-page paper out of South Korea that discussed how they did it, and I can send that along. But they kind of talked about the various techniques or various data sources they use, and that included things like GPS mobility data, but also CCTV data, shopping data, interview data, quite a bit, right? And they had like 28 data sources or so. And so that's been historically contact tracing. So you, one, ascertain that someone's infected, and then two, try to kind of link all the people that they've been in contact with. But there's also kind of a great deal of like, I guess, not error checking, but like manual intervention and common sense that's applied to make sure that that does seem right. So two people might have been in contact, but you look at CCTV footage and you see that they might be far across the room and never cross paths. So then you might ascertain that they were not affected, or and so that's kind of the background. And then from there, you can then set policies in place as to what you do, right? Whether you essentially say, the infected person needs to be quarantined, the people they've been in contact with have been need to be quarantined, or they need to voluntarily quarantine, or maybe you just tell them to monitor their symptoms, etc. So that's kind of a backdrop for like where we come into it. And so like fast forward, like maybe 3 months ago, November, and then closer to like January, as we saw in the outbreak in Asia, there became a rush to use technology to enhance contact tracing following South Korea and then Singapore. And they put together 2 frameworks to do such, right? And so they had the Singapore Trace Together app, and South Korea had another app, which I can't remember, but they were essentially technical mechanisms that would essentially augment the manual contact tracers, right? So you could essentially, when you go to the manual contact tracers, they could, so when you go and get tested, you could volunteer that information to the manual contact tracers, and then they would then be able to use that information to help supplement your memory and supplement their research to find out who you've been in contact with. And the Singapore app, for example, ran on both iOS and Android. It was a Bluetooth-based kind of proximity beacon mechanism, similar to some of the other proposals, except that when you set up the app, you were kind of instructed to register with your phone number and with some identifiable information that would then be sent to a central server, right? And so then when I'm tested positive, I could then volunteer that essentially my information and the beacons of the people that I've been in proximity with to be uploaded to the central server. And then that server could then reach out to you, Alan, if you were also running the app, or if you had your information in that system for the authority to call you, and et cetera. There have been other efforts, for example, in China, as you know, similar tools. It's not clear, there's not been a lot of actual kind of testing and reverse engineering that I've seen of the apps, but things we have seen kind of reporting that those same kind of tools are present, but more importantly that businesses and public kind of public transit and others require demonstrating the app, showing the app, presenting the app before you're able to, for example, enter a large building or enter public transportation. And one quick word about even the voluntary systems. So we said there's 2 pieces of information we want to know. One is whether or not someone's infected, and 2, who they've been in contact with. The whether or not someone's infected is also kind of a interesting topic. For example, the UK has a proposal for an app that's centralized based on kind of more closely mimics the Singapore app. I think they're actually using the same underlying open source code to build their app, from what I've read. And the key there is that there's this idea that like you still need to know who's infected, And there's two ways to do that. You either can verify your infection using a public health authority. So essentially you go get tested, the public health authority issues some code to you, like some QR code or some digital code, which then you use to then kind of upload your contacts, right? And that would, for example, require that there be ample testing available and that there be some infrastructure for health authorities to kind of relay that data. In the UK and in other instantiations, there's also some consideration of doing it via self-reported symptoms, or whether you can essentially say, like, I think I'm COVID positive because I have these 5 symptoms, and then I can alert the network and the people around me. I can notify them that I might be positive. And there's different kind of abuse and problems with those. And so there's essentially, kind of backing up, there's 2 categories of information. There's various technical implementations. There was actually something like 50 different approaches prior to the Google Apple announcement of their APIs. There was, companies looking at using audio beacons, for example, as a way, kind of a more privacy preserving way to do it. There was companies looking at place tags, where this is kind of like similar to iBeacon, where rather than our identities being correlated, each location, like a store, like your Whole Foods, will have a beacon, and then you and I would log that we were both in proximity to that beacon. And then there's been a ton of them, right? So they had various approaches, both in terms of the mechanism by which they determined proximity, whether it was Bluetooth, whether it was Bluetooth relative to an object, whether it was geolocation, whether it was audio beacons, variations on how the notification took place, and then there's also been different implementations on what is the result of these apps. What can you do with these apps? And some of them are simply just notify and raise awareness, some, about sheltering in place. Some of them are, as we've seen, kind of augmenting contact tracing so that the contact tracers can reach out to you and call you and have a conversation with you. And then some of them are as extreme as whether or not you're allowed to return back to work or use public transportation. I helped a reporter unravel PwC, for example, has a suite of products they're putting together now where for employers that are trying to decide whether to reopen, that they can require that their employees run these apps, and then the results of these apps will determine whether or not you're permitted to come back to work, which then starts getting us into this concept of like digital immunity cards. This isn't immunity, but this is the other side of it, digital tainted cards, basically, scarlet letters, essentially. So that's kind of the suite of it. We can talk about kind of maybe some of the motivations, if you like, and some of the kind of background on why and how the technology groups, how there's kind of, as you would expect, there's a lot of activity and a lot of infighting and a lot of like geeking out on kind of the details that do matter, but not all that much. And then there's a lot of like policymakers that are like, what the fuck? Right. Like what should we do? Sure, this looks good.
Yeah, one thing I'm interested to kind of unpack a little bit is, a lot of the conversation, as you say, in the technical circles and even in the tech law circles, centers on the concept of whether to do a decentralized or centralized model. To me, it seems that we're actually talking, as you said, about layers of centralization or decentralization. So the first is the contact data, whether that's stored centrally or stored locally, whether it's transmitted to a central repository or processed locally. But then there's also, as you said, the alert processor data, whether that's centralized. So that's your UK example of, do you allow self-reporting or not? To me, it seems like, and I'm interested to hear what you think, but at least on that kind of matrix, it seems like decentralized processing of the contact data seems better, but centralized certification of the actual alerts or notifications seems better. But I'm interested if you have.
Yeah, I mean, I think there's no, so the way I think about this is it's an engineering problem or engineering solution in search for a problem. And so when you say better, for what purpose, right? If is it so what we haven't established is what is the goal of these tools, and so that's where there's a lot of tension. So I think, and we can talk. I think it's important to talk about a little bit of the motivations of the actors or whatever. But kind of stepping back, if the goal is simply to raise awareness, then yes, there will be different factors. I think there are some issues with the decentralized model, but again, if there's protections in place around that data, and there's essentially or things like you're allowing self-reporting, and it's just to raise, it's like the DEFCON whatever, red, orange, green kind of thing, fine. If it's for the purpose of augmenting contact tracers, manual contact tracing, and helping epidemiologists trace down the virus, then there are, even with the technical approaches are limited whether they're centralized or not, right? And then if it's for kind of immunity passports and otherwise, like it's all bad.
Yeah.
So it depends on your perspective. Just a little background. So for like the month of March, I had been kind of back channeling with folks and understanding that like the administration was leaning heavily on a number of the tech companies to do something, right? The administration's been pushing on kind of a lot of sectors, telecom and tech and others, to essentially use data to help address this crisis, particularly because of the lack of actual test kits and the lack of actual kind of data around what's going on.
Yeah.
And some of the shadier like ad networks and location aggregators and others have been stepping up by essentially doing these fancy infovis graphs of like who's gone to Florida and then who goes home and all these kind of things. And that data itself has significant limitations in terms of adoption and how it's collected and whether people know it's adopted. But like if you look at CDC's reports, they cite companies like SafeGraph and I think it was UPromise was the other one. A number of these companies that are like embedded in like your Gas Buddy app or your, like your dating app.
Right.
And they are not representative of the entire population. They will be skewed in places like one of the companies whose name I'm forgetting now because it's been a month, but they cited like Alaska as the best shelter in place even before they had a shelter in place. And part of it was just the geography of Alaska, as well as the penetration of apps in those regions, right? But there's been a lot of pressure on tech to do something. And meanwhile, there was, as I said, this plethora of engineering solutions, some terrible, some, not as terrible, both from the privacy perspective, but also from the usability perspective, right? So companies like Apple and Google, via their app stores, are in the position of having to approve some Singapore's Trace Together app that like doesn't work well, drains batteries, isn't privacy preserving, and the Singapore government is instructing people to run this app, but make sure to like keep your phone unlocked and keep it in the foreground so it doesn't die, right? So they're also in this awkward position of like either having to have the PR nightmare of saying, well, sorry, Singapore, you're build a better app, you suck, or having to approve these apps. So I think part of the motivation for like putting together a solution is like, hey, we're doing something, lay off, we built something. Two, we don't have the data, so like you can't come, it's there's a good breakdown and good, I think it was CNET did a good rundown of the history of the timeline and who was involved, like Frederick from Signal, the kind of the messaging client was involved in the Apple protocol. Friendly version of this. And more importantly, let's not deal with any of the hard questions of like, where does the data live? Where does the data, like, what are the legal protections? What are the actions? What's even the messaging, right? And so the Google Apple API appeared, and it sucked a lot of the air out of the room and some of these other conversations. Meanwhile, MIT has had a proposal, DP3T, which is a bunch of Michael Veal and a bunch of folks in Europe, had been working on this proposal, which for the most part, Apple copied, right? So the Apple Google approach is very similar to the 3T approach. And then meanwhile, like France France has another proposal called Robert, which is based on a centralized model, closer to Singapore's model. So they all have like the pros and consequences, but it's important to understand the motivations. With regards to the decentralized model, there's two key issues, right? One is and that's what I wrote in that piece that I sent you.
Yeah.
The key, there's two key considerations. One, with the decentralized model, yes, it's privacy preserving because the company doesn't know who you've been in contact with, right? It's all stored on device. And in fact, there's this concept of like rotating identifiers to maintain basically make it ephemeral, so that it's only like certain windows of activity can be linked together. For example, like only 24 hours of activity can be linked to a particular key. So worst case scenario, you can, if you had a very dedicated attacker with sensors all over DC, you could trace together, if you were infected, and I could reverse engineer all the locations you've been. But that's kind of the balance of it. The issue is that that the decentralized approach, it works by essentially you and I emitting basically identifiers that our phones emit and listen to every 15 minutes. And those so the identifiers are actually, they're emitted more frequently than 15 minutes, but they rotate every 15 minutes. So you essentially emit a new number, like a new serial number every 15 minutes out into the ether. And then at some point, if I'm infected, I would upload the serial number to a cloud server somewhere, which is up to the health authorities to design and implement.
Yeah.
And then your phone at some interval would download that list of IDs of infected people and ascertain whether you were in proximity to those infected people. The challenge being, as I'm emitting these identifiers, I can do things like someone could record my face or a video camera or some other activity in conjunction with my emission of these. And your phone's actually emitting a buttload of things. So, it's very easy. Mobile retail tracking does this. It's very easy to detect a bunch of other identifiers from the device, such that when you then register yourself as identified in whatever form, the attacker is able to correlate these other identifiers, whether it's a video recording of me or whether it's a recording of other kind of radio-based signals that my phone gives off. You can correlate that attack. And so one of the properties of this distributed approach is that an attacker could link activity. It's called the linkage attack, right? And you can essentially know who's been infected or who reports themselves infected. So separate from the privacy properties, this distributed issue introduces its own kind of privacy problem. Yeah. The one that I'm more concerned about is twofold. One is, as I said, the way you determine whether or not you've been infected is going to be up to the health authority, the health app, whoever builds this app. And I've been doing some back channeling, and it appears that CDC isn't going to be building an app. In fact, everyone's kind of passing it around like a hot potato, and it sounds like they're going to look to the states to build their own app. In fact, 2 states have their own versions of apps, which are based on location. So Utah and North Dakota have location-based contact tracing or proximity alerting apps. They're not contact tracing, they're just like alerting you of locations of places that have been infected. But it's going to be up to the states to build their own contact tracing apps, including determining, for example, the server infrastructure required to receive and redistribute these systems, protecting that server infrastructure from things like denial of service and abuse attacks, which is very hard to do in a privacy preserving world, right? Because they're supposed to not, the guidelines for this infrastructure say to not record things like IP addresses or device identifiers from the devices when they upload their infected status, but nothing requires them not to do that. And in fact, Google and Apple would have a hard time knowing whether whether when Utah creates the new app and you upload your status, Alan, whether they, one, require you to create an account or log in or enter your phone number when you even first install the app, which they could, and which a lot of the, like the UK and Australia app do. And then whether when you upload your infected status, whether they record your IP address, your device identifiers, etc. So, and then at that, it also leaves up to the state to decide how, again, to verify that you've been infected, whether to let you self-report or whether to have some system that health officials can then verify your infection somehow. And that creates a whole another attack service that, that you can exploit, particularly overtaxed health. Health authorities are not well known for building secure, robust apps, particularly ones that are trying to be anonymous and maintain cryptographic protocols. Finally, there's one last class of attack that I kind of started tweeting about, and then I kind of deleted them, and I've been digging into it, and it's 100% works, and it's hard to defend. And someone actually sent me, well, I'll tell you some other details later, but and that's the ability to essentially we can get into the weeds if you want, but essentially there's a class of attack that would be, given the protocol, almost impossible to defend from, and it would permit you to generate a large-scale cascade of alerts, right? Even for the case where a health provider verifies it. An example of which would be, I convince all of you guys in DC and some friends in New York and some friends to install essentially a botnet, a consensual botnet, or the Liberate America app on your phone, or on your desktop. And then I essentially go to a clinic with my laptop of places where people are being tested, where people have a high and then I basically just amplify that across a large region at the same time that you're basically emitting it yourself. And then later, when in 3 days, Alan, when you test positive, I've then basically amplified your across the West Coast, and I can generate alerts on the West Coast, thereby essentially reducing its effectiveness. And again, if all it is like a mood ring for you to tell whether you maybe should stay home, whatever, right? Yeah. But if it's being used to determine whether people can, for example, enter a state, or whether they can travel, or where they can go back to work, that's when it starts getting real.
Yeah, that makes sense. I mean, one thing that I've been thinking about in respect to this, and concerns me a bit, is beyond the tech solutionism aspect of this, where it's kind of technologists doing technologist things. I do think there is on this public health authority side also a strong desire to be doing something more than they normally do. I mean, they need to do business as usual, but they clearly want to take it up a notch in some undefined way, and they're a little bit looking to technologists for what that is. And part of me wonders, if it can't be made to work, and maybe it can't in the U.S. at least, in some ways that we could define, is there a risk that they just reach to the next best thing off the shelf, which I think is basically mobile ad platforms, that they could just pick data up off the shelf and say, look, we already, if as an augmentation to contact tracing, we can augment, and we can just basically latch onto your device IDs or your ad IDs and just go full bore.
Right. I mean, so that's a real danger. Or location, right? Location has been the one, right? And in fact, I don't even think it has to go as far as, I mean, there's so many, I don't know if it's worth talking all the ways this could go south. Like telcos, right? Telcos are probably the best people for this data. And then there's a question of 50% plus of people would be willing to run an app even if it collected their location and was authenticated, right? And so and to your point, there is a kind of a vicious cycle, or a kind of feedback loop between technologists and public health folks, which is that they are very, what's crazy to me is when you read surveillance and public health literature, that's used as a positive term, right? It's often, it's got positive connotations, which I totally understand, because they're trying to save lives, and they are also under both duties of care in terms of their roles, right, as well as very strong legal restrictions on what that information can do. Like most of the stuff we've talked about so far does not fall under HIPAA, right? If you look at, for example, not apples to oranges, but apples letters Apple's letter to Blumenthal and others, where they were inquiring about the kind of the aggregate data that Apple was providing
Mm-hmm.
for the mobility
Mobility
trends.
check.
They,
Yeah.
yeah, they essentially said, no, this isn't the HIPAA data. Like, we have great security, but it doesn't involve a health provider, so it's not. I do recognize that the public health folks need help, right? The issue is that we don't have adequate testing,
Yeah.
and we need to get essentially kind of, it's a policy problem because we need to get people to stay home, right?
Yeah.
That shouldn't be out, but we realize that that's probably not going to work for 18 months,
Yeah.
right? So how do you do that? And so you might select the population, or again, like, find ways to either make more accurate the the actual contact tracing, or sorry, I have a call. Let me just um, make more accurate contact tracing, or at least make people more aware of the issues such that they individually can act, right? But I'm not sure that these technical solutions are being thought through well enough. Like, I personally, I'm of the feeling that a potentially more privacy invasive solution that's either based on location or that is centralized, in some ways could be better if it was more effective
Yeah.
and had more legal protections and policy protections around it, right? So so essentially, if this was done through a public health authority with resources both from the um, health side, but also from the kind of infrastructure side, that this data was secured and couldn't be abused from outside actors, from perspective of disinformation and kind of like hacktivists and others, that would make me feel better. And more importantly, I know this is probably not the epic line, but I think it would go far to then add, like, I don't know if you saw, the UK has some folks in the UK have put together some model legislation on some protections that would be provided to this data.
Yeah.
Like if you said like, it's an app that health authorities provide, that there's legal protections for, there's like crazy infrastructure and resources to do, it's actually more effective and it's voluntary, and you can't do shit with the data, I would actually be much more comfortable with that
Yeah.
than what this ad hoc kind of hodgepodge, every state doing their own random thing, and both doing a random app implementation, but also setting random policies around it.
Yeah, that makes sense. And I think that, there is, I see potentially, an opportunity. I don't know whether anyone will take it, but I think that as these, you know, COVID stimulus packages continue running through Congress, um, there may be an opportunity at a future point to say, hey, we need to address uh, contact tracing augmentation in one of these in order to be, give the public health authorities the tools they need to do it effectively and securely, and basically have a wish list of outlining, look, here are the things that the public health authority needs to do to make sure that data is secure, to make sure there's strict limits on how it can be used, that it's not going to be used for any purposes other than pandemic, it be deleted, etc. And yeah, maybe then in there, giving them centralized control over certain aspects of it could be better because they're so closely regulated, as opposed to letting it kind
Right.
of flow out.
Yeah. And there is appetite for that in Congress. I've talked to a couple Dems, at least, that are interested in trying to do something, both from the perspective of like, yes, there needs to be protections, but also from the perspective of who the hell is going to build it and build it well,
Yeah.
right? Which is the question. Like, the CDC did receive, a chunk of money in the CARE package and the CARE Act,
Right.
that was for surveillance, but that's for their traditional network of hospital surveillance, not
Right.
for this type of stuff. And I think it's remarkably absent from that, particularly because they don't want to touch it.
Yeah.
Like, it's such a thorny issue that no one wants to touch it. And as soon as you touch it, like, as you guys think about doing stuff in this, you might look at like Germany and how that played out, because Germany is traditionally a privacy friendly kind of environment from a policy perspective, but they initially, it's politically been a nightmare for them, because they initially had a centralized solution that all the advocates freaked out about, and then GDPR restriction discussions popped in, and then now they're considering this centralized model, but then all these hard questions that I just raised come up, and they're kind of at a standstill. And then meanwhile, like, you know, the Australia just said screw it, they rolled out their app, and they got something like, what was it, 5 million downloads in the first night or something like that. And people didn't care. So I think there's opportunities to both draw a fence around the dangers of this information, as well as argue that policymakers, and in fact, you know, a lot of what I've been arguing with is independent of whether or not there's a Google API or not. There are essentially, functionally, Google and Apple are the gatekeepers here with their app stores, right? Whatever app gets passed and implemented, they occupy a really important role. And for things like, so as I said, the API, the proposal is privacy preserving, but ultimately the health authority that develops it, and really the contractor that they hire to develop it, is going to have the say as to what information is collected when you sign up for the app, whether phone number or location can be collected, as well as what information is collected on the backend server in terms of logging and how that's secured. And Google have privately said, for example, that we will only grant permission to this API to health agencies. And they've also said that they will be prohibited from accessing a location if they want to use this API. But that's not actually concrete written anywhere. There's no best practices guidelines or documentation. And that could be made available too, so that when the French government's like, hey, Google, you know, you're blocking our app and people are dying, they're not put in the awkward position of having to approve these apps that are more privacy invasive.
Right, that makes sense.
It's thorny. I mean, you're in this weird world where, like, yeah, I don't know where you guys are, but like I'm finding myself like in some ways agreeing with Stu Baker. I had a call, I was on a radio interview with him, and we're kind of saying the same thing. And like, you know, something's wrong when you're you know, this is when like the Bush moment where he's painting and you're like, oh man, I like Bush. Like, it's one of those moments, right? But it's true that we're in this world where I think we're all trying to find a solution, and the issue is that right now it's being driven by tech, and policymakers and you know, health officials are overtaxed, and so they don't have a lot of. They're basically letting tech lead the way, which has been, I think.
And it's certainly our view is and one of the things we emphasize in our statement is that this cannot be, you know, a replacement for the essential things we need, like testing capacity, and now clearly manual contact tracing capacity as well. This is at best an augmentation if it works.
And I do, just along those lines, I think that there's maybe some value in, again, stepping back and like, we're letting tech dictate the conversation, specifically around this narrow thing, which is exposure notification, right? Not even contact tracing. And kind of going back from a policy perspective of trying to identify what are the things we really want, and then what are the safeguards, and kind of how should those be implemented, right? So this might be like the higher level question of like what Kentucky and Hawaii are doing, and what, you know, state, like the tools that states need, right? So they want to know who's infected, right? They want to know who they've been in contact with, and then they want to provide restrictions based on that in some sensible way, right? And so we've talked about the contact tracing apps as one, but there's also digital immunity passports. There's also the shelter-in-place restrictions and quarantining kind of tracking, which is what, like, you know, Kentucky has like 1 or 2 instances where they required ankle bracelets for people that broke their 14-day quarantine. And Hawaii has had these practices where they're considering ankle bracelets, but they've, for the last month, required that when you visit, even intra-island travel, that you have to like check in on a daily basis with your geolocation, for example, through some crappy website. But so those are the things. So people are going to want to know who's infected, who they've been in contact with, whether they, and then provide restrictions on whether those people can travel or roam freely or go back to work or use public transportation, etc. And so the question is, what are the protections that need to be placed around there, right? I don't know if you guys want to be in a position where you say like, hey, like So the question is like, a real basic example is, under what conditions can someone walk into Whole Foods or go back to work,
Yeah.
right? And one position is anyone should have the right to, unless they've been demonstrably infected, right? Um, and then you have to figure out what that threshold is. Or you might say, no, there needs to be some ways to limit the spread, but there needs to be rights around that. Like the one, I don't know if you saw the conversation I got into with Omer and one of his colleagues last night about, so in Israel, as you guys know, their intelligence agency was tasked with essentially using cell phone data from the cell phone provider to do contact tracing.
Mm-hmm.
So they essentially have some arrangement similar to how the NSA monitors mobility abroad, but they do it in country. So I guess it'd be the equivalent of their FBI, but it's their intelligence agency that has the ability to monitor their own citizens. They were using location data to do essentially contact tracing, right? And I've written about this when there's a program the NSA has called Code Traveler, which is the same program here in the US. And so one individual, a doctor, was tested and he tested negative, but the Ministry of Health mismarked their status as infected. And then so the Ministry of Health then tasked the ISA to then do contact tracing and text all of their contacts that they need to quarantine in place for 14 days.
Yeah.
Right. And so that was a fat finger. That wasn't a technology issue per se, although it might have to do with the automated nature of it, because that could have happened with manual contact tracing. But what was kind of reassuring is two things. One, the Supreme Court said, no, you have no oversight, and the ISA is tracking their citizens. This isn't constitutional, so they just struck down the program altogether. But separately, there's an appeals process for essentially, if you are notified to say shelter in place, they're put into place a process where you can appeal that. And so that to me is actually a promising development, right?
Yeah.
Where you need some way to essentially demonstrate that the technology can be wrong, and then have some scalable way to respond to that.
Yeah, that's interesting. I want to see if anyone on staff has any questions.
Hi, John Davison.
Hey.
I was curious, do we have any hard data yet on the effectiveness of contact tracing apps? Is someone working on collecting that? Like, what's the situation?
Apps or contact tracing? Because there's two separate things, right? So
digital contact tracing as opposed to manual.
Yeah, I mean, so I did see, so DP3T, which is Michael Veal, he's kind of part of the privacy community. He kind of jumped into it. So in March, as these things were kind of percolating, and there were all these approaches to do contact tracing, they kicked off this, I forgot what the acronym is, but it's a privacy preserving, it's basically the Apple protocol, right? And they essentially started their approach was like, this is all terrible, but if you're going to do it, at least do it in a privacy preserving way. And so they've been kind of documenting this whole thing all the way through, including they've very well laid out they have a nice document of all the security and privacy issues surrounding the protocol, DP3T, which is very similar to the Apple protocol, but also they're doing tests of efficacy and measuring essentially like ground truth data with cameras and and then also instrumenting their app to figure out what things like false positive and false negative rates are, right? But I mean, that's the fundamental question of efficacy, again, will come down to what you're trying to do. If you're trying to help someone who's interacting with a manual contact tracer remember or filter through who they might have been in contact with, that's a different question of efficacy than if you're trying to alert people that they might have been in contact with. And in both cases, as you know, they suffer from false positives. This is things like, people could be wearing personal protective equipment, but not have been in substantial contact, or they may be in apartment buildings separated by a wall, but still see Bluetooth signals. but more importantly, false negatives, right? And this is not just the case where people don't have the phone on them, which would occur, but the fact that the properties of these kind of tools are based on the effectiveness is based on network effects, Metcalfe's law, right? Which is proportional to these 1 over the square of the number of people that have it, right? So in the US, we have 81% penetration of smartphones, right? Because kids and adults, like older folks, don't have it. And there's some data to say kids aren't that communicative for the virus and they're lesser risk. But regardless, even if every single person in the US that has a smartphone had this app installed, 1 over 81 squared is 65. So 65% efficacy is the best case you could get with this, right? And so the question of what you do with it and efficacy comes down to, if you're trying to just help improve manual contact tracing, it will probably help somewhat. If you're trying to actually tell people when to reopen or when it's safe to go back to work, it's actually going to have an inverse effect where it's going to provide people with a false sense of confidence, right? You might be, Alan looks a little red, like you might be feeling symptomatic, but you look down to your app and your app's like, no, you're green. You haven't been in contact with someone. Particularly in the early days, is not a lot of people have adopted the app. It's going to be green for a lot of people, right? So you're going to say, oh, I'm probably fine to go back to work, even though you're like vomiting blood, right? It's like,